So we are going to talk about diets that have been approved by health authorities. By health authorities, I'm talking about organizations like Health Canada, Heart Health Association, and all these bodies of authorities who look at meta research and come up with these conclusions. They've seen evidence, and most of these evidence look for long-term success. So one of the most common diets that we recommend in general is the Mediterranean diet because of the benefits that come with the Mediterranean diet. So in 2016, Canadian Cardiovascular Society guidelines provided that a strong evidence and recommendation for following a Mediterranean diet pattern to help reduce the risk of cardiovascular disease. Now, with any diet, whatever diets I'm going to talk about, it all involves calorie restriction. If you're eating more than your calorie needs, you still won't be able to see success with weight loss. So any diet is good, but the diets that have other benefits beyond weight loss are the ones I'm going to mention. So this is a typical eating pattern when it comes to Mediterranean diets. So we start with the lowest tier down here at the pyramid. So the most important thing when it comes to any healthy eating pattern involves an active lifestyle. And then the next biggest tier in the pyramid here is water. So making sure you're getting enough water. And that's where the food starts. So in most Mediterranean diet patterns, they recommend at least eating 1 to 2 fruits every single day and more than 2 servings of vegetables every single day. And they can be mixed, cooked or raw. And then if you see here, breads, pastas, and rice are also part of the meal pattern, but they only eat about the amount that is recommended is between 1 to 2 servings. The next good part about the Mediterranean diet that it involves things like plant-based proteins and things like nuts and seeds. So they actually recommend eating nuts, seeds, and olives at least 1 to 2 servings every week. Dairy products are also recommended, at least 2 servings, preferably low fat. And if you notice here, this little up here, the triangle, it gets smaller and smaller. So the amounts of meats and potatoes and sweets are reduced in this diet. So you eat more fruits and vegetables, you eat more whole grains and then some dairy. So that's basically a pretty healthy eating pattern. And this is recommended because a lot of people have seen great results and good health benefits while following this diet pattern. Now, just to recap, because Mediterranean diet is high in plant-based proteins from fruits and vegetables, there's use of olive oil, which is the main ingredient in their cooking and their meal preparations. They use a lot of tree nuts, less red meats. They have a good balance of essential fats. And this is good because it helps reduce inflammation. And so that's one of the reasons why Mediterranean diet works. The other diet, which is very common, commonly you've probably heard about it, is the DASH diet, or dietary approaches to stop hypertension. This diet is recommended for people who have hypertension, but this is also good for anybody who is trying to lose weight, as long as you do a calorie restriction. So the point with the DASH diet is that it has a lot of fiber, and fiber coming from sources like fruits and vegetables. So if you notice here, this is the typical eating pattern for DASH diet. So about 6 to 8 servings of grains, vegetables 4 to 5, and then fruits 4 to 5. So if you add that together, that's between 4 to 10 servings of fruits and vegetables alone in a day. So that's a lot of fruits and vegetables. But that shows that because fruits and vegetables are so high in potassium, they help reduce the blood pressure. And that's why more fruits and vegetables are recommended. Low-fat dairy is recommended. And then lean meats, nuts and seeds, about 4 to 5 per week, fats and oils, and then sweets, 5 or less per week. Now, by 5, they mean 1 serving is 1 tablespoon, so up to 5 a week. That's quite little. So this is basically reinforcing the concept we've already talked about, reducing added sugar, replacing whole grain, regular grains with whole grains. So similar concepts are in mind. Okay. So I move on to the next diet that is actually a combination of the Mediterranean and a DASH diet. It's called the MIND diet. And actually, evidence shows that it does help reduce dementia and Alzheimer's and the risk of that, because the emphasis is mostly on fruits and vegetables, nuts, whole grains, fish, beans, berries, and olive oil. So it's a kind of a mix between the Mediterranean and the DASH diet. And this diet also helps focuses on limiting red meats, fried foods, pastries, and unsaturated fats. Now, this is the summary of the MIND diet, and this is also in your package. But if you see here, they recommend daily 1 salad, 1 other vegetable, 3 servings of whole grains, and a glass of wine. This is optional. And then mostly slack on nuts, and then every day or every other day have beans. And then per week, poultry and berries, once per week, fish. Now, this one is another diet. It's called a portfolio diet, and there's evidence to support that this diet helps lower cholesterol. This is actually from University of Toronto, this diet originated. Now, the focus of this diet is, if you notice, they don't really have serving size per food group. They focus on the proteins and the types of proteins. Their focus really is to increase the fiber and the viscous fiber. So it's as long as you're getting on average 45 grams of nuts in a day, plant protein, examples would be beans and soy, lentils, chickpeas, all of these, about 50 grams daily. Sticky viscous fiber, so they're mostly talking about vegetables and fruits that are very high in fiber and the sticky fiber, and this is usually found in okra and eggplants, in strawberries, in psyllium husks, and some nuts and seeds, and oats. And then increased plant sterols, which is usually found, it is added to a lot of food products to decrease cholesterol. So that's another type of diet which works. Generally, vegetarian diets work depending on how you're following it. This is one of the vegetarian diet pyramids. More physical activity. Pretty much most of your diet should be filled with fruits and vegetables. And then the next would be whole grains, beans, nuts, spices, and plant oils. And the last tier up here has eggs and dairy products. Okay. So now this is not a diet per se, but this is basically low-calorie diet. Low-calorie diets mean there are between 900 to 1,000 calories. And this is usually prescribed to people who want rapid weight loss for medical reasons or for surgery, but this should be medically supervised, and it should also consist of meal replacements. And I think one of you mentioned OptiFast, so I'll get to that, but it's also important whenever you go on a very low calorie diet, like this one, like 900 to 1,000 calories, the amount of protein you get is important. If you don't get enough protein, so it's basically almost double the amount of protein you would get on a regular diet, because we want to make sure there's no protein loss or muscle loss with low calorie diets. So the meal replacements come in different ways. You could do a full meal replacement. So they actually provide you with, I think the OptiFast provides you with 900 calories. So if you take 4 sachets a day, that provides a total of 900 calories. You can also do partial meal replacement. So you can actually do your meals and then have a meal replacement, and that kind of varies in calories. Dr. Saima, do you want to add anything on OptiFast?
Yeah, I sure. So the first thing what I would like you to know, that whatever the diets we have been studying so far, the common denominator is actually, you would find some sort of a calorie restriction. That's the whole concept here. Either you do calorie restriction by lower down your protein or your fat or your carbs. That's the whole concept here. So usually when it comes to meal replacement, and when you really go very low in calories, your body usually shuts down. So below 900, it's very, very low calorie, and nobody recommends to go below 900s. So the one that has been shown by research is between 900 to 1000 as low calorie diet, but again it has to be supervised, and it has to be coupled with intensive psychotherapy as well as some good amount of protein. The protein would be in the meal replacement. So either if you're going on meal replacement, which is a very strict 900 calorie diet, the research has shown that one can sustain up to 6 months, and yeah, 12% of weight loss in within 6 months if you do meal replacement psychotherapy. Basically, some say 20% of the weight loss in 26 weeks. So that's weight. Now, when you see about meal replacement, so you will hear a lot of meal replacements. The one that we talked about, OptiFast is the one that the research, the RCT has been done on OptiFast till 26 week. It is the only meal replacement that has been approved by Health Canada, and it is a prescription one. You would not be finding OptiFast in Amazon or any online stores or any grocery stores. It has to be medically supervised, and it's a prescription meal replacement. So my office do have OptiFast. Now there are others that you would find it on Amazon and stuff, as long as they have adequate amount of protein and stuff you can carry on. But maybe the results are the same, but we know about OptiFast because the research has been done on it. We have the data on it. So that's the one that we usually go for it.